health equity. I'm trying to get the slides to go back one. There we go. Health equity in tobacco control is the opportunity for all people to live a healthy tobacco-free life, regardless of the socially determined situations or characteristics. And this contextualized definition is significant because it alludes to the importance of being tobacco-free, as tobacco use remains the leading cause of preventable death and disease in the United States. As a process, health equity would be addressing the factors that influence tobacco-related disparities. Tobacco-related disparities are one way we can measure our progress toward achieving health equity in tobacco control. Researchers and practitioners in attendance at the National Conference on Tobacco and Health Disparities in 2002 defined tobacco-related health disparities as differences in the patterns, prevention, and treatment of tobacco use, and an amended definition by Fagan and colleagues specifically highlights differences in exposure to tobacco use initiation, current use, the number of cigarettes smoked per day, quitting, relapse, as well as the subsequent health consequences among specific population groups and related differences in capacity and access to resources. Let me be clear that, like all health disparities, tobacco-related disparities influence various population groups based on socially determined circumstances and characteristics. However, this presentation is focused on racial disparities and more specifically on African Americans, largely because African Americans bear the greatest health burden related to tobacco of any racial ethnic group. These findings were reported back in the 1998 Surgeon General's report specific to racial and ethnic minorities. It was said during this time period that prevention of health problems within racial and ethnic groups would be integral to achieving national goals to reduce health disparities. In 1995, before this report was finalized, the overall African American mortality rate was 60% higher than that of whites, which was precisely what it had been since 1950. Still today, tobacco use contributes to 3 of the leading causes of death in African Americans. That's heart disease, cancer, stroke, and it increases the risk of developing diabetes, which is the 5th leading cause of death among African Americans. Here we see racial differences in mortality rates for Blacks and whites by decade since 1950 until 2017. And although gaps have lessened across time, they still exist for most of these leading causes of death. And we know that there are additional differences if we were to also look at intersections with gender or socioeconomic status. Black men are about 15% more likely to develop lung cancer than white men, and the risk of developing diabetes is 30 to 40% higher for smokers than non-smokers. While we must acknowledge there are several challenges to accurate measurement of product use, such as capturing use patterns among the incarcerated, among which African Americans are disproportionately represented, a rich understanding of patterns of tobacco use is critical to effective intervention and prevention. However, aggregating data can sometimes mask underlying differences in tobacco use rates, and those differences, or the knowledge of those differences, are important for developing equitable policy and programs. African American smokers are more likely to smoke mentholated products and initiate regular patterns of tobacco use at older ages than whites. We also know that African Americans report using fewer cigarettes per day. However, it is also important to look across products beyond cigarette smoking patterns, as you can see here in this figure. Data in this figure show that African Americans have slightly higher rates of any combustible tobacco product use, with higher rates of cigar and pipe or hookah, while whites have slightly higher any tobacco use rates, due in part to their higher rates of e-cigarettes and use of smokeless tobacco. African Americans are also more likely to be exposed to secondhand smoke, and despite higher reported quit attempts, are less likely to successfully quit than the general population. So I've highlighted some disparities in tobacco use, but why do these disparities exist? While much of the literature has focused on important individual level factors like age of initiation and frequency of use, The NCI monograph number 22 emphasized that health disparities are the result of multiple mechanisms and not one single mechanism. The ecological model depicted on the screen helps us see that individuals are embedded within a broader context of influences which interact across various levels to shape health disparities, and these influences may vary across the life course. It's important to note that differences in patterns of use, quitting, and health-related outcomes are not naturally occurring, but they result from a complex mix of differential exposures to societal risks and patterned inequalities for which race can be seen as a salient marker. Phelan and Link's research on fundamental causes of disease highlighted the role that social conditions have played in shaping neighborhood contexts in which individuals live, work, learn, and play, while Williams and Collins highlighted the role of residential segregation as a fundamental cause of racial health disparities because it led to the racial patterning of neighborhoods and racial differences in socioeconomic status that still exists today by determining access to education and employment opportunities. And Yerger and colleagues analyzed over 400 tobacco industry documents looking at how individual, social, and geographic factors, including racism and segregation, how they created what they term riskscapes, and how the intersection of these factors shaped how the tobacco industry targeted their marketing to low-income African Americans between the 1970s and 90s, which in turn continued to shape these riskscapes and health disparities. Tobacco products are one of the most heavily marketed consumer products in the US, with more than $1 million spent every hour on advertising. However, early tobacco ads like the first Bull Durham advertisement you see on the screen here at the turn of the 19th century depicted African Americans in childlike or racist ways. Only since the 1940s have they aggressively targeted African Americans as a distinct consumer market. And industry documents reveal that this change was due to changes in the purchasing power of African Americans from the 1940s to the 1970s. And that purchasing power rose from about 3 billion to roughly 32 billion during that time period. White flight and the racialized geography of cities challenged marketers to develop innovative methods to sell their products at the small-scale retail stores which remained in cities when major retailers left, and also to account for challenges to the retail visibility and space constraints in these stores. Consequently, the neighborhood retail outlet has become a prominent setting for advertising tobacco products and messaging in support of tobacco. In the late 1970s, tobacco companies began using billboards to advertise cigarettes in racial and ethnic minority communities, and a study by Primick and colleagues found far more billboards advertising tobacco products in minority neighborhoods than in other neighborhoods. But since the Master Settlement Agreement of 1998 banned billboard advertising, tobacco companies have continually invested efforts into the retail outlet, where similar disproportionate trends in retailer and ad density have been observed. Lee and colleagues in their study, which looked at 97 US counties, found positive associations between tobacco outlet density and the proportion of residents identifying as Black or African American. And Kong and colleagues did a study in Mecklenburg County and found that neighborhoods with the highest proportion of Black residents were significantly closer to multiple tobacco retailers than those with the lowest proportion of Black residents. So not only are retailers more prevalent in African American communities, but so is product advertising. Exposure to ads is associated with increased use rates as well as brand recall, but what messages are actually being sent? Early messaging studies in print media by Warner and Altman reported that the emergence of health-themed ads were there to allay fears, as well as themes focused on adventure and risk. And other studies reported on the racial segmentation of advertising and drew comparisons between white and African American print media. These studies revealed themes focused on menthol or escape or fantasy and expensive objects in African American as compared to white magazines. Pauley specifically identified filter advertisements were delayed within African American compared to white print media ads. And the NCI Tobacco Monograph, number 19, summarized tobacco advertising into three themes: providing satisfaction, assuaging anxieties about the dangers of smoking, and creating associations between smoking and desirable outcomes. However, Kozlowski and O'Connor integrated themes from prior research into a sort of different framework, suggesting that there were three overarching strategies called reassurance, misdirection of attention, and inducement to bravery. Reassurance convinces consumers that tobacco use is safe despite health risks. Misdirection of attention redirects consumers' focus from health risks toward positive product attributes, and inducement to bravery incites courage to use despite risks. So we see in this first print can ad, the focus is on the filter, whereas in the misdirection ad, the focus is on the satisfaction brought about by cool. And the inducement to bravery ad is focused on the full taste and depicts a race car driver, which I would consider a risky profession. So here we see a sample of more recent point of sale ads. And while we won't discuss out loud, I'd like you to take a brief moment to think about which ads use which strategy: reassurance, misdirection of attention, or inducement to bravery. Understanding how messaging strategies are used in African American communities is important because of documented disparities in retail density and ad exposure, as I've mentioned. Moreover, we thought there was a need to assess ad content across non-cigarette tobacco products in the retail environment, as most of the studies I presented talked about ads in print media, specifically for cigarettes. And we thought this was important due to the changing product landscape. So the objective of this cross-sectional study from 2018, which was recently published in the Tobacco and Health Equity Supplement of Health Promotion Practice, was to assess the use of these three strategies and examine whether these messaging strategies varied by product type. Although I talk specifically about our study, I do highly encourage you to check out the other point of sale focused articles in the supplement. It is currently open access. Now switching to methods. When considering the setting for this study, we wanted to engage locally, and Greensboro had several rich historic attributes. Considering industry statements with respect to geographic concentration, we used the HOLC map, one of which is depicted on the screen, representing areas the federal government deemed high risk for mortgage lending to inform us specifically about residential segregation in Greensboro. Areas with or next to African American neighborhoods were redlined or marked red as hazardous or yellow as declining, leading to concentrated economic deprivation. In the early 1950s, Lorillard moved its manufacturing operations to Greensboro near East Market Street, roughly 2 miles from the campus of North Carolina A&T University and Bennett College, both of which are historically Black colleges and universities, and roughly 4 miles away from the Warnersville neighborhood, Greensboro's first planned community, established for the formerly enslaved around 1867. Interesting enough, today, ITG Brands, which took over the Lorillard plant, their operations are located within the red or yellow area that was represented on the HOLC map, and their corporate offices within the blue or green areas, which were not deemed risky. The historic images of Greensboro school desegregation here with Josephine Boyd and the Greensboro 4 sit-in leaders provide a little context for the character and resolve of the African American community within Greensboro, as well as Greensboro's connection to the changing civil rights landscape. Segregation in Greensboro initially declined during the 1970s, but was reversed during the 1980s. According to the North Carolina Health Equity Report, African Americans smoked at a higher rate than whites in 2016, and we see that rates vary geographically across the city of Greensboro from this map, with higher rates of use clustering around those same redlined areas from the HOLC map. Rates are much higher than the overall state rate from the same time period. And with respect to population demographics, we see Greensboro, which is North Carolina's third largest city, is more racially and ethnically diverse than the state overall. And this map also shows the geographic distribution of the Black or African American population in 2018, which remains largely within those same areas as the HOLC map and the map with higher smoking prevalence. So for our study, we follow the process of the recommendations by Feld and colleagues for conducting retail store observations, and we determined we would obtain access to retailer lists by using Counter Tools Store Mapper. We did not use the standardized tobacco assessment for retail settings, or STARS, for this study, largely due to the time and funding constraints and the very specific focus of our study on messaging strategies. However, our measures were mainly close-ended as is recommended. For our measures, we assessed product type for cigarettes, any non-large cigar, and any electronic nicotine delivery system, commonly e-cigarettes for many of you. Messaging type was determined from ad content and was coded as either reassurance, misdirection of attention, or inducement to bravery. And we captured brand names for top market share brands per product type, and any others we put into an aggregate other category per product type. Ad locations included on the premises, building windows or doors, and in front of the register or behind the register or other. And the remaining measures were either dichotomous yes or no options with an open-ended option to capture any text description. We created an electronic form using Qualtrics survey software to facilitate data collection using mobile devices, and our data collectors were trained on how to identify an ad, categorize the messaging strategy, and on how to use the electronic form to collect data. The form and store audit procedures were piloted at 3 stores outside of the study area identified to ensure adequate inter-rater reliability. Reynolds and Brown and Williamson tobacco documents detail the use of zip codes and a specific population threshold of African Americans to determine neighborhoods to target with marketing. So we used these same strategies and Census Reporter to identify Greensboro zip codes comprised demographically of African Americans using 45% as a threshold, and then census tracts within those zip codes that also met that criterion, leaving us with 15 census tracts. Once the census tracts were identified, we used our Counter Tools retailer list to identify and sort stores within those census tracts, and each store was called to verify that they were still in business, that they sold tobacco products, and their hours of operation. And as a secondary verification measure, we looked up each store's address in Google Maps and used the street view to confirm that the stores listed had sold tobacco products by looking at whether they had ads on their building windows, doors, or store premises. And then we wanted to ensure the safety of our ad raters, so we reviewed crimes using crimemapping.com and selected business hours when crime was less likely. After removing any retailers who were no longer in business or did not sell tobacco or any duplicates or stores that were deemed unsafe, our list yielded 24 stores. So on to our findings. On average, 74% of the study population was African American. 5 of the 15 census tracts in our study actually met the U.S. Department of Housing and Urban Development definition of a racial concentration of poverty, which means having a non-white population of at least 50% and at least 40% living in poverty. The number of stores varied per census tract, so we saw about an average of 2 stores per census tract. Stores were mostly a combination of gas and convenience stores, and most ads were for cigarettes. Among cigarette brands, Newport ads were most frequent, followed closely by Kool and Marlboro, and then ads for non-large cigar brands other than Black & Mild or Swisher Sweets were observed most frequently, so things like Owl or Game for non-large cigar ads, and ads for Blue were observed most frequently among ends ads. Most ads were located outside on either the property or building edifice. Inside, most ads were behind the counter, and price was included about 50% of the time. Most of the ads included images, and the majority of ads that used misdirection of attention or reassurance included images of the pack or product, whereas only 20% of ads employing inducement to bravery included images of the pack or product. Humans were really not depicted that frequently in the ads, but when they were depicted, all of the images were of white folks. And overall, the misdirection of attention strategy was used more frequently compared to reassurance and inducement to bravery. Moreover, the frequency of messaging strategies varied significantly by product type, as you can see here in this figure. END's advertisements included within our sample did not use inducement to bravery as a strategy, but relied most frequently on reassurance messaging. And cigarettes used reassurance less frequently than other messaging strategies. Primarily, they use misdirection of attention. In addition to the frequency of ads, we also analyzed the ad text and images. So while we know that the frequency of ad messaging strategies varied, we wanted to see what specifically the messages were conveying. And here we can see some keywords emerge by merely looking at ad word frequencies in aggregate, which is the arrow. However, when we parsed the ad text out by messaging strategy, the actual messages became a bit more clear. So for reassurance, we see things like natural, misdirection of attention, things like enjoy, and inducement to bravery, things like bold. The next few slides provide snapshots of ad text that enrich the analysis and represent our further study of the themes. And different sub-themes were embodied in the messaging strategy. For misdirection of attention, ads redirected attention specifically to physical, financial, or social or status relief. For reassurance, ads attempted to reassure consumers of product safety by focusing on innovation or being different or being natural. And for inducement to bravery, ads focused on a sense of power or control. The next few slides show poem-like illuminations of the data and present an expanded interpretive view. So for physical relief, we have like sweets, enjoy, smooth, select, flavorful, refreshing, pleasure, last longer, satisfies better, pleasure, cigarettes. For financial relief, stack your savings, everyday savings, special price, new resize pack, resealable foil pouch, more of what matters. And for social or status relief, we see limited release, cognac dipped, hand-rolled, Newport Platinum, come to where the flavor is, join the Circle K Tobacco Club. With regard to reassurance, particularly for innovation or something different, we see something better, something better, blue, smoking, evolved, hashtag vaporize, tobacco, mint, fruit, brulee, no odor, no ash, no tobacco smoke, only vapor, smoke virtually anywhere, clear cartridge, sleek design, the game has changed. And for safety with respect to being natural, we see go natural, a fresh take, refreshingly menthol, the natural choice, natural rolled leaf cigars. And then finally, for inducement to bravery, for cultivating a sense of power and control, we see soar above the rest, step up your game, bold choice, let it ride, Marlboro Midnight. So our findings should be interpreted with caution, and they may not generalize outside of North Carolina to all African American communities or to stores or advertisements not included in our sample. Moreover, it's possible that ad messages may integrate multiple strategies. Nevertheless, we found that cigarettes and non-large cigar ad messages most frequently redirected attention to other product attributes away from the harmfulness of products, and END's ad messages primarily use reassurance to elicit perceptions of safety. They were also the least commonly advertised products in our study, despite it being in an area with high smoking prevalence. So what do these findings mean? So if I said ball or get me the ball, the message conveyed is entirely context dependent, signifying that the context matters. The message sender is aware of that. And so even if we have the same words, the context really helps or serves as a clue to determine the interpretation. Here we see if I say ball in the first top left box, you're going to think a baseball, right? Whereas in the bottom right box, you're going to think of a basketball. So context matters. So when we think about the messages sent in African American neighborhoods, the industry is aware of this fact, and they know that words are not just words. Acknowledging the lens through which African Americans may view things and how the context shapes the meaning of concepts. They've done this here, saying that African American sees the America through a prism of 350 years of discrimination, or that the context that they live in affects the meaning of concepts or influences the meaning of concepts. So it's important that we also contextualize these findings, and the results of our racially contextualized study highlight that variation in tobacco retail ad messaging by product is systematic and not the result of chance. Ends have also been promoted as part of harm reduction strategies for users least successful or likely to quit. However, the ends, as I mentioned, were least commonly advertised in our study with an area of high smoking prevalence. And this seems consistent with historical trends of delayed filtered cigarette advertisements in minority compared to white media outlets. Some ends in our study actually included white hands holding the product, suggesting that ads may have targeted white passersby, and these findings align with other studies that report ends may be targeted more to whites or the status conscious. Importantly, cigarette and non-large cigar ads, which were most frequent, disproportionately use messaging designed to misdirect focus from health risks to positive product attributes. And in this study, misdirection ads frequently emphasize words such as enjoy, pleasure, or satisfies. Such messaging suggests that products can meet or provide relief for basic vulnerabilities induced by the physical and psychosocial environments. In light of this, our findings are consistent with industry documents acknowledging the pressures associated with disadvantage, such as financial burdens or stress, and describing the intentional segmentation of primarily Black smokers based on needs to relax or find pleasure. According to the elaboration likelihood model, directing focus to or associating products with positive attributes or feelings, not health facts that need evaluation, really makes it easier for audiences to accept the messaging content. And so here we have taken that messaging content from the ads we found and applied it to that same Maslow's hierarchy that the industry used. Attitudes resulting from indirect persuasion are thought to be temporary, which may explain strong desires to quit. However, the addiction supported by advertised products is long-term, and that may coincide with difficulty quitting successfully. So our study found that tobacco messaging strategies are not uniformly applied across all product types, and the ads found in our sample of disadvantaged African American communities disproportionately employ misdirection attention messaging strategies that prey upon and may thus exacerbate existing vulnerabilities. So here we see the segregation sort of setting a stage for the disadvantage in the communities and the disproportionate burden of retailers and advertisements, as well as messaging impacting the use and purchase of products, which may then exacerbate those vulnerabilities by maintaining an addiction. However, I don't want the takeaway message to negatively focus on the residents of these communities, right? We see here an opinion editorial written by a resident of Southeast Greensboro back in 2014, advocating away from this convenience store that was going to sell tobacco products coming into her neighborhood. So community residents are vocal, they're not passive, nor have they sat idly by. And remember, historically, tobacco is not the only issue they have stood up against. During a community meeting in Greensboro to prioritize health issues, the members in attendance ranked youth tobacco use as the #1 priority and adult smoking as #4 out of 12 other health issues. signifying the relative importance of this issue. Moreover, African Americans are more likely to make quit attempts. So as our work continues to our next phase, it's important that we keep our work grounded and learn from the community, specifically listening to their voices and elevating and echoing them when possible, acknowledging the work that's been done and is being done currently, and finding ways to support them with resources and building relationships with them, and then noting ways to build upon their momentum and use equity-focused approaches. Future efforts to eliminate tobacco-related health disparities should include strategies to achieve parity or reduce risk exposure differences between residentially segregated areas and minimize socially determined vulnerabilities through policy and environmental change. Policy change often includes policies at the legislative or organizational level, while systems change involves change made to the rules within an organization, and systems change and policy change often work hand in hand. Environmental change is really making change to that physical and social environment. Golden and colleagues have reconceptualized the social ecological model I showed you earlier, specific to policy and environmental change, so that the focal point is on the development of health-related policies and environments rather than on just the individual. And that change is produced by organized and intentional human action, and then measuring whether the policy and environmental change efforts promoted by the field are equitably distributed across population groups. The CDC also recommends policies to address tobacco-related health disparities focused on reducing exposure to advertisements and improving cessation and the overall access to that cessation resources. A primary focus must remain on limiting the number of retailers who sell and advertise tobacco, but not necessarily on just reducing the number of retailers in African American communities, as that may have unintended consequences. Although we did not use the STARS audit that I mentioned earlier, the STARS policy crosswalk provided a lot of guidance on identifying relevant policies to address the tobacco control issues relevant to the context and findings from our study. One of the recommendations is local licensing ordinances where not preempted by state law, and as a strategy to cap the number of licenses for stores and facilitate store transitions away from selling tobacco products to products that actually meet community needs. Also, policies that ban the sale and advertising of menthol and other flavored products would effectively limit the most frequent products in our study and reduce exposure to the misdirection and reassurance messaging used to entice consumers to initiate use. Modeling studies indicate that if we banned menthol back in 2011, it would have saved over 500,000 lives by 2050, with about 37% of those among Blacks. Although the House has approved a bill to ban menthol, federal ban is not a reality in the United States. And a ban was recently passed in the European Union and the UK and in Ontario, Canada, where cessation rates have been noted to increase. If enacted here, such a ban would have a broader reach than local efforts. However, until a federal ban becomes a reality, state and local efforts must continue in partnership with communities. But policies must be sure not to exempt menthol if they are to equitably reach populations. So a flavored e-cig ban is not enough. In addition, focused efforts to improve equitable access to evidence-based cessation resources are necessary among populations burdened by tobacco-related health disparities. Since North Carolina preempts localities from creating policies around tobacco advertising and sale, the work done in Mecklenburg County by their Public Health's Office of Policy and Prevention really serves as a good model for work that could be done here in Greensboro to promote and normalize quitting by building relationships with retailers, encouraging them to voluntarily display quit line information in stores, and improving the health promoting aspects of the retail environment. So in conclusion, as new tobacco products continue to emerge and advertise strategies unrelentingly exploit vulnerable populations and neighborhoods, and we really don't need to debate anymore whether disparities exist, but we need to pivot and focus on implementing strategies that reduce and eliminate them. And we want to make sure that the policy and practice efforts we implement remain focused on equity so that residents of all neighborhoods have opportunities to lead healthy tobacco-free lives. So here are my references, and thank you so much for your time today.
Thank you, Carrie. Dr. Rosario, we have a few questions.
Okay.
The first question is it possible to share the data on the stores in Mecklenburg? I work in tobacco control in Mecklenburg, and this is useful when we discuss marketing of products.
Okay, yeah.
Yeah, go ahead.
Just want to make sure I'm understanding the question there. So this study was focused in Greensboro, North Carolina, but I did note Mecklenburg County's efforts as a promising practice that could be implemented here, working with communities to do similar work as Mecklenburg County has done. So if you're part of that work being done in Mecklenburg County, I would love to talk to you because I think there really is some meaningful work being done there that could be modeled and used as a best practice for work to do in Greensboro.
Great. And we have another question. Oh, and this is an interesting question. Did you say most ads with people depicted showed white folks? That is so counterintuitive from an advertising position. Do you have any thoughts as to why that would be the case?
Great question. So yes, you were correct in hearing me. All of the human images in any of the ads that we observed were depicting non-Black or non-minorities. And you would think in an area that is 74% Black population that you would see differently. However, this is more of an urban area, and I would say that, there's obviously traffic there. It's not completely Black area, so it's possible that one of the reasons was to attract other passerbys to those products. However, some of the research literature looking at ads in the past have noted that sometimes African Americans were attracted to advertisements that were not solely racially segmented, right? So it's possible that they could still listen to the messaging from the ads, even if they depicted other races, including whites. So while it does seem counterintuitive, I think we don't want to make too many assumptions about it, but from the literature, that's not completely uncommon, particularly with those advertisements being for electronic nicotine delivery systems.
That's really fascinating. We have another question. In doing store observation, I found it interesting that celebrities have their own brands, such as Snoop Dogg, or advertise for different brands of cigarillos. Has there been any thought of adding the same ban on celebrities endorsing these products like traditional cigarettes? Do you have any idea about that?
Well, my work really hasn't focused too much on the celebrity aspect of it, although I do know that there are several celebrities that have endorsed certain brands. I know that Cardi B has worn some cigarillo shoes in the past. And I think, we have to be careful because a lot of the times when we're advocating against certain things, one of the common messages that comes up is the First Amendment and freedom of speech. And so I think we would have to be strategic about finding a way to encourage against that endorsement. And I think, social media not being a tool, as some of the dual-focused, anti-dual-focused efforts have mentioned, would be a place to sort of start with that.
And so let's see. Oh, we've got 2 more questions. Ann Staples says, this is such fascinating work. Do you have plans to do more research in this area?
Hi, Anne. Yes, I would. This was a small scale study here in Greensboro. I would like to continue doing some of this work with perhaps more representative samples outside of Greensboro and perhaps outside of North Carolina. So the answer to that is yes.
Oh, and I really like this next question too. Have you discussed your findings in a focus group format with minority members of the Greensboro census tracts that you studied? And if so, what were their reactions?
So that's an excellent question. I think this study was a first point, and our next steps are really to engage locally with community members and even retailers in those areas. So thank you for that question, as it is something we are looking forward to doing in the future.
Okay, next question is, did you run into any information or data regarding merchant education on age restrictions and the knowledge of Tobacco 21?
So my short answer to that would be no. At the time we were doing this study, it was back in 2018, and so the recent legislation had not been passed yet. And here in North Carolina, we know that while we do have that federal age restriction, the state law is not yet at 21. So no, those were not my observations at the time point that we were doing this study.
Okay. Next question is, do you think there would be any promise in conducting a similar study for LGBTQ+ communities?
Absolutely.
Yeah.
I think it would be a little bit more challenging to identify, right? So here we have residential segregation that really enabled us to see the geographic concentration of African American population in Greensboro. So it'd be a little bit different in locating, but I think a similar study of advertisements, whether they're in retail stores or elsewhere, would be really important work, as we recognize that there are disparities that span outside of race and ethnicity, and definitely that population would be of interest.
Yeah. Are you familiar with the FDA campaign, Every Try Count? It's retail based. Yeah, it has not run in North Carolina yet. Every Try Counts. You're familiar with that,
Yes.
Dr. Rosario? Yes. Can you tell us a little bit, for those who might not be familiar with it, can you tell us a little more about it?
You want me to tell you a little bit more about Every Try Counts?
Oh, you said you're familiar with it. I'm sorry.
I've heard of it.
Okay.
It's a cessation campaign.
Yeah, I believe so.
Yes, it's a cessation campaign, and I think it's focused on trying to get people feeling like it's okay if it didn't work the first time, right? That every try is important, and that it's not about quitting on the first try. And in fact, it's going to take most people more than once to successfully quit. And so it's a campaign sort of normalizing that that effort to keep trying regardless of the initial outcomes. I will say that there's some work that that was being done. It's not a campaign per se, but there was some work that was being done around tailoring tobacco cessation messaging for quit lines by Dr. Monica Webb Hooper to see if some of the evidence-based interventions could be integrated into the quit line services. So she's done some work around Pathways to Freedom, which is tailored or targeted to African Americans, and trying to integrate some of that evidence-based messaging into quit lines. And I believe she was doing a study with the quit line here in North Carolina to improve cessation rates, since African Americans are more likely to try quitting.
Okay, so it looks like we have another question. What do you think has been an effective advertising campaign to counterattack tobacco, like bringing the facts how tobacco has damaged human life? Would ad campaigns be more effective than banning by counties, cities, states, and or work different strategies as a whole tactic?
Well, I think with anything, even thinking back to that socio-ecological model, multiple strategies I think are important. So I don't know if it's an either or thing, but I would actually advocate for using multiple approaches, both of which are pretty important. So I'm not sure if there are more aspects of that question that I didn't answer, but please let me know if there was something that I didn't answer from that.
Sure. Well, and I don't have much of a question. Oh, I do have a thought, but I'll wait till we finish with our participant questions. Do you think the advertising themes you identified in this study resonate in any way with smokers who are living with mental illness?
That is an excellent question. And while we didn't look specifically at that, I would think when you're talking about relief, right, physical relief, or relief related to physical relief, I would consider mental health in there, and so I think probably that misdirection of attention marketing, messaging rather, would be the one that I would think would align most closely with mental health issues.
Yeah. One of the themes that I found really fascinating was the safety or reassurance theme, especially the fact, and this was new information for me, that there has been a lag in getting that messaging to the African American community, starting with filtered cigarettes and then now with ends. And I that was new information. I find that really interesting, that there was a lag in advertising in that way to the African American community. And any thoughts on
Sure.
Yeah.
So I think you can think of that sort of two ways, and one way from some of the research that I've done with regard to this is that this idea of indirect persuasion being a little bit more effective for just immediately accepting the messaging, rather than really thinking about it and weighing out the validity of it. And when you're thinking about health risks, and I think from the research that I've done, the overall standpoint is that African Americans are more wary of what you're telling them about something being risky or not to their health. And they know that cigarettes are risky, right? They know that from all the work that's been done over the past 50 years, they know that that those are risky. But this new electronic stuff, right? There's less known out there, and so I think the reassurance messaging is not marketed as much in these communities because one, they may not be as receptive to it in that way at this time point. I think it's important to monitor that though, because I'm not sure that that messaging and those types of products won't be marketed more in African American communities. And I think it's important to keep the goal on quitting and not switching.
Yeah. And we have one last question. This will be our last question for today. Is there any work being done in Greensboro on adopting a content-neutral signage policy to reduce the advertising load at the point of sale?
Content. Can you read that last part one more time?
Sure.
I'm sorry, there's a little background noise.
Yes, sure. Adopting a content-neutral signage policy to reduce the advertising load at the point of sale. Is there any work being done in Greensboro on adopting content-neutral signage policy?
I'm not sure.
Yeah, I'm not
quite
sure.
Honest.
I'm not sure either. I'm in Greensboro as well, and I'm unsure.
I know there's been some work done to make the signs, not just so specific to cigarettes, but I don't know if that's work that's been done to reduce the burden at the point of sale, particularly in these neighborhoods.
Yeah, and they clarified, meaning a signage policy not specifically directed at tobacco ads, but all ads. And yeah, I'm not aware of anything either. So, well, thank you so much, Dr. Rosario, for being with us today. This was so fascinating. I know we all got a lot out of it, and we appreciate your research in this area. It's so needed. For our participants, the slides and the recording will be emailed to you and also available on our website in the next couple of days. So thank you all for attending today, and we will see you again sometime in August for our next quarterly webinar series.
Thank you.
Thank you.